Welcome to an HMC HealthWorks webinar. Let's talk about heart health. According to the American Heart Association, 1 in 3 deaths is caused by heart disease. Coronary artery disease is the most common form of heart disease and also the leading cause of death and disability in the United States for both men and women. Approximately 1.5 million heart attacks and strokes occur every year in the United States. More than 800,000 people in the U.S. die from cardiovascular disease each year, and about 160,000 of them occur in people under the age of 65. Heart disease actually kills roughly the same number of people in the U.S. each year as cancer, lower respiratory diseases, including pneumonia, and accidents combined. In addition to the personal and physical toll on individuals and their families, heart disease and stroke are among the most widespread and costly health problems facing our nation today. Families who experience heart disease or stroke have to deal not only with medical bills, but also lost wages and the real potential of a decreased standard of living. The impact is enormous. Heart disease and stroke cost the nation an estimated $316.6 billion in healthcare cost and lost productivity. These numbers are certainly overwhelming, but what many folks are not aware of is that your best defense against coronary artery disease and other cardiovascular problems, including stroke, it is within your control. Before we talk about the many things that you can do every day to prevent strokes, heart attacks, and reduce your risk for heart disease, I want to talk a little bit about the heart itself. Did you know that your heart is the size of your fist, and it's also the strongest muscle in your body? It started beating about 3 weeks after you were conceived, and if you live to be 70, it will have beaten 2.5 billion times. The system can also be weakened by a pre-existing heart condition or other physiological factors, including hypertension or high blood pressure or cholesterol. When your heart's functions become compromised, this is known as cardiovascular disease, and it's a broad term that covers any disorder to the system that has the heart at its center. Heart disease occurs when plaque develops in the arteries and the blood vessels that lead to the heart. This ends up blocking important nutrients and oxygen from reaching your heart. Plaque is a waxy substance made up of cholesterol, fatty molecules, and minerals. Other things that can factor into heart disease are things such as genetic factors, which also increase your risk of developing heart disease. However, unhealthy lifestyle choices actually play the biggest role. A sedentary lifestyle where your job and leisure activities involve little or no physical activity doubles your risk of dying from heart disease. This is like the increased risk if you'd smoked, had high cholesterol, or had high blood pressure. It's actually easier than many folks might think to improve your health with exercise. I was concerned in my own life that if I didn't have an hour to exercise, I wouldn't reap any benefits. And then I read a study from Kaiser Permanente that said you don't have to jog for an hour a day. Then, in fact, some studies have shown greater health benefits from light to moderate exercise simply because people are more likely to stick with it. Your heart health improves with just 30 minutes of exercise on most days. That could be 2 15-minute segments of exercise or 3 10-minute segments, and they still count as 30 minutes. Just make sure the activity is vigorous enough to raise the heart rate. Try the talk-sing test. If you can't talk while you're exercising, you're working too hard. But if you can sing, you need to work a little bit harder. So you're probably wondering exactly what it is about exercise that helps keep our heart healthier. This is what happens physically when we exercise. Just as exercise strengthens other muscles in your body, it helps your heart muscle become more efficient and better able to pump blood throughout your body. This means that the heart pushes out more blood with each beat, which is allowing it to beat slower, and it will keep your blood pressure under control. When you exercise regularly, your body's tissue, including the heart, does a better job of pulling oxygen from your blood. This allows your heart to work better under stress and keeps you from getting winded during high-intensity workouts. Physical activity also allows better blood flow into the small blood vessels around your heart. Clogs in these arteries can lead to heart attacks. Exercise increases your level of HDL cholesterol, which is the good cholesterol, that lowers heart disease by flushing out the risky artery clogging LDL or the bad cholesterol from your system. Exercise to stimulate, not annihilate. The world wasn't formed in a day, and neither were we. Set small goals and build upon them. And remember, with exercising, small steps can start big change. Just getting 10 minutes of physical activity each day can lower your risk of having a heart attack significantly. Aiming for 30 minutes a day could potentially lower your risk even more. And when talking about lack of exercise or movement, one of the biggest factors in our modern society that contributes to poor heart health is too much screen time. If you tend to spend 4 hours or more sitting in front of your TV, your computer, your laptop, or on your phone or other devices, your risk of having a heart attack is almost double. And remembering, when you're considering how much screen time you spend, you need to take into account what you spend at work. Limit your screen time and spend more time on your feet to reduce this risk. And also, when we talk about exercise, many people's minds go to an image of being at a gym, lifting weights, and other vigorous and strenuous activities. It's important to remember that there are many forms of exercising. For example, walking is free. It works wonder on our physical and emotional well-being. And on days when it's inclement weather, there are free online walk at home videos, which combine marching and other movement to achieve the same effect. Another great place to walk is during work breaks, and you can walk inside or outdoors or do the stairs, and you could do it solo, but also check to see if anyone wants to be your walking buddy. Dancing is another wonderful form of exercising. You can do it at home with a video or just free form to your favorite tunes. Local rec departments, gyms, and venues with DJs or live music are all places where you can dance. Dancing is a full body workout, and music, it often makes you feel like you want to tap your feet on their own. Doing stairs and taking steps everywhere are also free and good ways to get exercise. Another thing I like to do is parking further away when I'm going places. It really adds some steps. Along with lowering your risk factors for heart disease, the CDC reports that exercise also, it helps you sleep better, it improves your mood, it lowers your risk for some types of cancer, it will improve your balance. Also, it will reduce osteoporosis by increasing your bone mass, gives you more energy, and exercise helps keep your weight down. And while we're discussing exercise, this leads me to another area which is a big problem and a root of heart disease, and that is an unhealthy diet that's high in sodium, fat proteins, trans fats, and sugary foods. Americans are overconsuming salt, unhealthy fats, processed meats, and sugary sweet beverages. And along with that, we're also underconsuming fruits, vegetables, nuts and seeds, whole grains, vegetable oils, and healthy proteins, and fish. So just as with exercise, small steps can eventually lead to big changes. So when we're trying to change our diet and improve, eat more of the good and less of the bad. And start by making just one of these healthier choices each day, and then just try to build on it. So first and foremost, a great place to start is to replace sugary drinks, sodas, sports drinks, and replace them with water, seltzer, or unsweetened tea or coffee. The next great place to start after you conquer the food and beverages is to buy some lower sodium versions of common canned recipes like tuna, beans, tomatoes, and other vegetables. And if you can't find low sodium or no salt, just rinse the contents under a colander to wash away some of the salt. And also, choose poultry and fish and try to limit red meat. Always look for leaner pieces, skinless, or trim away skin or any visible fat before cooking. Another thing, look for whole grains and lower sodium when you buy things like bread, cracker, and snacks. Also, choose fresh fruits when affordable and available. If you're going to choose canned, make sure that it's packed in juice and not syrup. And finally, switch from white rice to brown rice. Also, another area is switch from processed deli meat and use like leftover rotisserie roasted chicken and make a hearty sandwich that way. Also, when you're adding toppings to pizza, taco, or sandwiches, add one more veggie instead of an extra meat or cheese. And then also, snack on crunchy vegetables or nuts instead of chips. So while we're focused on changing our choices to improve our heart health, one of the biggest things that someone can do is to quit smoking. Smokers have a 70% higher death rate from coronary artery disease than non-smokers. And it's really interesting. About 50 years ago, roughly 42% of US adults smoked. I mean, it was common nearly everywhere. The smoking rate's decline has coincided with an increased public understanding that smoking is a big cause of heart disease, cancer, and other lethal health problems. Today, 14% of US adults smoke. And what's amazing is, according to the CDC, in the past 5 years, 3 out of 5 adults who smoked successfully quit. So if you smoke, talk to your doctor about ways to cut back and quit. You can also contact HMC HealthWorks or enroll in your organization's smoking cessation program. So another heart helper that you can control is to avoid excessive drinking. Moderate drinking, which is 1 drink a day for women and 2 for men, appears to protect some people against heart disease. So if you're wondering how to gauge one drink is 12 ounces of beer or wine cooler, 5 ounces of wine, or 1.5 ounces of 80 proof liquor. And if you're having problems staying within that moderate range, talk to your doctor about getting some help with your problem drinking. Another thing that can hinder your heart health is staying in a high stress environment without proper stress management techniques. Long-term activation of your body's stress response system, along with prolonged exposure to cortisol and all those other stress hormones, may put you at risk for heart health troubles. Talk to your doctor about stress management techniques. The American Heart Association and our HMC HealthWorks stress management programs suggest some small changes, which are luckily easy to try. And next, one thing that's easy is get giggling. Make silly faces with the family or have a staring contest. Watch videos of babies and puppy. Whatever gets your belly moving, try blowing off some steam with some laughs. Another really important thing that I employ a lot at work and at home is breathing. You've been breathing your whole life, but learning to focus on your breath can trigger your body's relaxation response. According to Dr. Herbert Benson, a cardiologist at Harvard Med School, he's a professor of mind-body medicine. Deep breathing is one of several ways to elicit the relaxation response. Try it and you'll be getting your zen on in no time. The way you start is take a comfy and take a normal breath. Next, take a deep breath slowly through your nose, filling up your chest and belly. And now breathe out slowly through your mouth and repeat. Another way to deal with stress too is make a list. Making a list can help you decide what's important to do today so you don't feel buried all the time. And the added bonus is you'll feel a sense of accomplishment when you cross things off as done. I can practically hear you saying, already. Another thing that's great for your heart and mind and helps with stress is movement. Movement's good for your heart. Dance like crazy to get your funk out. Try hula hooping. Briskly walk around the block. Listen to the birds. Take a hip hop class that you've always wanted to try. Bonus points if you laugh while you're moving. Another really huge thing is getting enough sleep. It can help you feel less cranky and overwhelmed, and also you'll be more productive and creative. And if you want all that, you got to get to bed earlier. Turn off the screens. Sleep experts suggest aiming for about 7 to 9 hours of sleep a night. Remember, get your butt in bed. The last thing you can control to improve heart health is if you're a diabetic, make sure you're managing your diabetes. All the things we discussed previously, from exercise, healthy eating, weight, and stress management, are all a part of that, but your medication adherence is a must. Half of the people with a chronic disease such as diabetes do not take their medication as prescribed. More than 20% of new prescriptions are never filled, and approximately 30% of people with diabetes report missing at least 1 dose of oral medication per month. Sometimes we get busy or for whatever reason, we don't take all the doses of our medicines. Talk to your doctor to arrive at solutions and, start brainstorming. Ask yourself these questions. How many times in a given week do you miss taking your medicines? What gets in the way of taking your medicines as prescribed? Travel, your work schedule, falling asleep, pressures of getting your kids off to school. Also, another thing is cost a frequent barrier? And does the medication fit within your budget? If cost is a barrier, your doctor can advise on a combination of medications, less expensive alternative medications due to generics or, ranking tier insurance levels. There's also patient assistance programs. And finally, ask what's helped others and how you can fit into your plan. As we close our heart health webinar today, we want to remind you that as we talked about heart disease today, the most important news is that we've shown that most all the risk factors other than genetic are controllable. And even if you have genetic disposition, following all of these advice points will also help overcome that genetic risk. Be sure to visit HMC HealthWorks website at hmchealthworks.com to learn more about health topics. Thank you for joining us today, and stay tuned for future HMC HealthWorks webinars.